Hi, I'm Dr Nelson Amaral, and I'm a consultant cardiologist at the Clementine Churchill Hospital in Harrow. Today we're tackling some of the most common questions about blood pressure, from what those numbers mean to how to keep them in check. So let's dive in. So what is blood pressure? So imagine your blood like a river, flowing through your body. The force it takes to push that river along, that's your blood pressure. It goes up and down like the tides, highest when your heart beats and sends blood flowing forward, and lowest when your heart is in between beats and the water flow slows down. So blood pressure is the force that keeps your blood moving around the body. How is blood pressure measured? You've probably had your blood pressure checked before, and then you might already know this. The reading comes in two parts, like 100/80. The first number is your systolic blood pressure. This is the big push, the highest pressure when your heart beats and sends blood flowing forward. The second number is your diastolic blood pressure. This is when your heart is in between beats and is relaxing. The blood flow slows right down and the pressure is at its lowest point. And blood pressure is measured in units of millimeters of mercury. What is normal blood pressure? Have you ever had your blood pressure checked, but you've been left confused by the numbers? Don't worry, that's actually quite common. Here's a quick breakdown on how to make sense of your readings. A blood pressure below 120/80 is considered optimal, but readings between 90/60 and 120/80 are regarded as normal and healthy. Low blood pressure is generally defined as a blood pressure below 90/60. This blood pressure chart might help you understand your own blood pressure readings further. And which is the most important number in blood pressure? Blood pressure readings can be confusing. The first number, the systolic blood pressure, usually gets more attention because it can be a bigger risk factor for heart problems. But the second number, the diastolic blood pressure, matters too. So the truth is, both numbers are important and neither one tells the whole story for everyone. The best advice? If either number is high, talk to your doctor. They can help you understand your readings and what it means for you specifically. And what does it mean to have high blood pressure? Your blood pressure is like a roller coaster. It goes up during exercise to give you that extra push and comes down again when you're resting. But if your blood pressure stays high, even when you're relaxing, that's called high blood pressure or hypertension. Think of your heart as a pump. It has to work extra hard when your pressure is high. If your readings are 140/90 or higher, your doctor might suggest ways to bring your blood pressure back down to a healthy range. What causes high blood pressure? So for most adults, there's no single reason why the blood pressure creeps up. We call this primary hypertension, and it basically means high blood pressure that develops over time. So what makes those numbers go up? Well, it's usually a combination of things. Not enough physical activity and unhealthy eating habits. Certain health conditions like diabetes or obesity can play a role. And even pregnancy can cause temporary spikes in blood pressure. About 10% of cases of high blood pressure is caused by other medical conditions, such as hormonal imbalances, kidney disease, or even sleep apnea. This is called secondary hypertension. What can I do to prevent high blood pressure? It's really all about healthy habits if you want to keep your blood pressure in check. Try to eat well, move your body, and stay at a healthy weight. So try and add plenty of fruits and vegetables to your diet. Try and add regular physical activity to your everyday life, for example, a brisk walk, and aim for a healthy weight. Take it easy on the alcohol and coffee. We all love a good latte, but too many could increase your blood pressure. And the same goes for alcohol. So moderation is really key here. If you smoke, try and give up if you can, and you can see almost immediate improvements to your health. Dealing with stress is also really important. Getting enough sleep and finding ways to unwind, whether it's reading a book or taking a relaxing bath, can really work wonders for your blood pressure. Even if your blood pressure is already a bit high, these tips are a great first step to bring your blood pressure down. And if you want to monitor your blood pressure at home, no problem. Get a home monitor and take readings at rest. Keep a diary to track them, and if they're consistently high, so above 140/90, see your doctor for a checkup. What causes low blood pressure? Don't worry if your numbers are a little lower than most. Low blood pressure or hypotension is actually less common than high blood pressure. The magic number to remember is 90/60, and that's the cutoff for when your doctor might want to take a look. Now, there are all sorts of reasons why your blood pressure might be on the low side, and some of them are nothing to fret about. Superfit athletes or even younger women often have naturally lower blood pressure, for instance. It can also run in the family or be a normal effect of aging. Even pregnancy can cause a temporary dip in blood pressure. Of course, sometimes low blood pressure can be linked to medications or health conditions like diabetes. So if you're feeling dizzy or lightheaded, it's worth mentioning it to your doctor. Is low blood pressure dangerous? Low blood pressure might sound scary, but it's not always a big problem. The key is to listen to your body. Do you feel dizzy, lightheaded, or like you might faint? That could be a sign your blood pressure is running a little low. Other things to watch for are blurry vision, feeling sick or weak, or even confusion. So if these symptoms are popping up frequently, it's a good idea to get your blood pressure checked. In most cases, low blood pressure can be managed by figuring out what's causing it in the first place, or simply by making some lifestyle tweaks. And your doctor can help you figure out the best course of action for you. So hopefully this video clears things up about high and low blood pressure. And if you still have questions, no problem, feel free to ask anything in the comment section below. And if you want to dive deeper and chat about your blood pressure and heart health, with me personally or any of the consultants in your area, just book an appointment at circlehealthgroup.co.uk.